We will be learning about neurocutaneous syndromes today. Let's start. So, as the name suggests, neurocutaneous syndromes. These syndromes have certain neurological features and certain cutaneous, that is skin features. Now, these skin features are the features that are frequently asked in your exams. Listen to this chapter carefully. We are going to finish this in no time and we are going to finish this in a very easy way. You will not forget it ever. Now, let's start with neurofibromatosis, NF. Now, there are two types of neurofibromatosis, NF1 and NF2. We all know about that. The differences between the two are NF1 is actually the most common neurocutaneous syndrome. The prevalence lies between 1 per 3000. Out of 3000 people, one person tends to have NF1. While NF2, a little bit less prevalent, but it is easy to remember the prevalence of NF2 also because that is 1 per 30,000. So we can remember 1 per 3,000 and 1 per 30,000. Now, as we know, the chromosome that is involved in NF1 is 17q 11.2 and in NF2 is 22q and 12.2 to be precise, but all they ask for in exam is 17q and 22q. We will remember that. Now, they also ask about the protein that is encoded by this gene. Every gene encodes a protein, we know that from our biology classes. Now, NF1 encodes the protein neurofibromin and NF2 encodes the protein Merlin. So we will remember these, right? Now let's start with the features of NF1. It is very easy to remember NF1 features. Let's start with the mnemonic. Now NF1, at least 2 out of 6 should be there. At least 2 out of 6 should be there. Very easy to remember. The mnemonic goes like 622 Air Force Station out. 622 AFS out. 622 Air Force Station out, right? Now 6 stands for at least 6 cafe au lait spots. Cafe au lait spots are hypopigmented macules. We are going to look at the pictures later on, right? 2. At least 2 neurofibromas. Neurofibromas are actually mobile subcutaneous lumps that are felt and they are usually present on the trunk, on the arms, mainly on the arms and the legs. So limbs, basically appendicular and axial, are also there. So chest and trunk are also involved. More than or equal to 2 neurofibromas or at least one plexiform neurofibroma. A plexiform neurofibroma is kind of a large neurofibroma. It is a large tumor-like lump. It looks like a tumor, usually present on the forehead or on the scalp, occipital scalp or the frontal scalp. So one plexiform neurofibroma, the main site we know about, and at least 2 Lish nodules. Lish nodules are the iris nodules. They are present in the iris. We are going to look at the pictures. Be patient with me. Remember the mnemonic for now. So more than or equal to 2 Lish nodules on the iris. A stands for axillary freckling. A stands for axillary freckling. These are the spots that are present in the axilla. Please remember, axillary freckling is a feature of neurofibromatosis type 1. F stands for we can also say freckling. So we can remember it like this, axillary freckling. That's why I put this F after A. Secondly, we can also use this F for family history. So if there is a first degree family relative, first degree relative, right? I hope you know what are the degrees of relatives. We'll talk about this during our genetics chapters too. First degree relative with neurofibromatosis 1 also puts you at risk of neurofibromatosis type 1. S stands for sphenoid bone dysplasia. What is S? S is sphenoid bone dysplasia. Now this O is very important. Out. This O is very important. This O stands for optic nerve gliomas. This O stands for optic nerve gliomas. Optic nerve gliomas are present in at least 15% of neurofibromatosis type 1 patients. Take a screenshot of this. You need to remember this mnemonic. So let's change the color and I'll tell you the questions that are asked in NF1. Right? So the main questions that are asked are: number 1, most common neurocutaneous syndrome. Most common neurocutaneous syndrome is neurofibromatosis type 1. If neurofibromatosis type 1 is not there in the options, but neurofibromatosis, tuberous sclerosis, VHL, von Hippel-Lindau syndromes are there, you have to mark neurofibromatosis. If they have given NF1, NF2 as two options, you mark NF1. Correct? So this is question number 1. Second question that is asked are the chromosomes that are involved, 17q and 22q. So now we remember NF1 17q, NF2 22q. The third question that is asked are the features. They ask about the features. So remember this mnemonic, 622 Air Force Station out. 622 Air Force Station out. Please put this in your mind, in a special memory space, and don't let it get out, right? 622 AFS out. जैसे पायलट्स बोलते हैं उसी तरीके से निमोनिक बनाया 622 एयरफोर्स स्टेशन आउट 622 AFS out, right? So remember that. The fourth important question that is asked is this: what is the percentage of optic nerve gliomas in neurofibromatosis type 1? And the answer is 15%. So now we are going to erase this. Let me erase this and we'll move on to neurofibromatosis type 2. Let's move on to neurofibromatosis type 2. We'll also look at the features, the images, so that we remember about these. Let's first talk about neurofibromatosis type 2. Neurofibromatosis type 2 is also known as Miss-Me syndrome. Miss-Me syndrome. Now this Miss-Me, इसकी full form में ही neurofibromatosis type 2 के features हैं, right? So this is very, very important for us. Miss-Me syndrome. Miss-Me stands for multiple inherited schwannomas, meningiomas, and can anybody guess? Another benign tumor, ependymomas. Correct. So Miss-Me syndrome, multiple inherited schwannomas, meningiomas, ependymoma. So ये तो नाम से ही पता चल रहा है कि how what are the features of neurofibromatosis 2. Now there is one name I need you to remember. NF1 is also known as von Recklinghausen's disease. Recklinghausen's disease. One tip for you students: whenever you find similar things, for example mnemonics, you can put it in your notes. So make one notebook that has all your mnemonics so that you can revise those on the morning of the exam or the previous day before your exam or maybe 2 days prior to your exam. But you know, the time is really important. You need to read the questions carefully, you need to answer timely, right? So answer timely will happen only when it comes into your memory space timely, and that requires revision. And if you have put together all the mnemonics in one place, it will be very easy to recall. Trust me, I'm a neurologist, it will be very easy to recall. So do that. Make a notebook for mnemonics, start writing a mnemonics. Whenever you confront a mnemonic, you please write it down there in that notebook, right? Secondly, for example, there is other name for NF1, von Recklinghausen's disease. So make a notebook for another names, for the other names, right? And you put it down. NF1, also known as, put a sign of equal and write von Recklinghausen's disease, and that's it. Keep those two notebooks always with you, right? So let's move on to the questions that are asked in this. So number one question that is usually asked is, what is the chromosome of NF1? So we know 22q, 12.2 to be precise, but they usually give the option of 22q. The second question that is asked is the schwannomas. So bilateral acoustic schwannomas, correct, is a feature of NF2. The third question that is asked is schwannoma. Where do we find schwannoma of spinal nerve root? Now, very importantly, if they ask schwannomas or acoustic nerve schwannomas, you answer NF2. But if the question says, where do we find schwannoma of spinal nerve root? The answer is going to be neurofibromatosis type 1. The answer is going to be neurofibromatosis type 1. Remember this. Take a screenshot. Let's move on. The second neurocutaneous syndrome that we are going to talk about is tuberous sclerosis. Before moving on to tuberous sclerosis, let's look at the cutaneous features. So I think I have an album over here, and let's look at the features. this one and this one. I hope you are able to see this. Let's make this bigger. Save these pictures for you so that you remember. Number one, what are these? These are hyperpigmented macules. Now these are cafe au lait spots. These are cafe au lait spots found in NF1. Correct. Very good. NF1. And secondly, these are the features of NF1, and it is very important to remember these. Now, in children with this autosomal dominant neurofibromatosis type 1, learning disabilities larger than average head size are the features. Now, these are the Lish nodules. These are the Lish nodules, iris nodules, right? Scoliosis is again a feature of neurofibromatosis type 1. Axillary and groin freckling are features of neurofibromatosis type 1. Flat feet are features of NF1. Again, cafe au lait spots, axillary freckling, neurofibromas, the small, small lumps. A plexiform neurofibroma is a big lump on the forehead or the occipital scalp. And right here, this is the optic nerve glioma. Now, if you keep this picture in your mind, you'll be able to remember most of the features. Apart from this, you only need to remember the mnemonic that we used for NF1, 622 Air Force Station out, 622 AFS out. So let's move on. Let's move on. Let's move on to neurofibromatosis. We have covered neurofibromatosis. Let's move on to tuberous sclerosis. Right. So if we talk about tuberous sclerosis, again there are two types. Tuberous sclerosis, the short form that we use is TSC, tuberous sclerosis. Again there are two types, TSC1 and TSC2. Now TSC1, again the chromosomes are asked, so please look at this carefully and listen very carefully. TSC1 is usually on the gene 9q34 and TSC2 is 16p 13.3, correct. So 9q and 16p, these are the two things that you need to remember, 9q and 16p. Then we need to know the proteins. So the protein that is encoded by TSC1 gene is hamartin, and the protein that is encoded by TSC2 is tuberin. Tuberin. So hamartin and tuberin are the two proteins that are encoded in TSC1 and TSC2 respectively, right? Now, what exactly these proteins do is they inhibit the mTOR pathway. This mTOR pathway is a pathway in the cell cycle. This is a cell cycle regulator. Now, when a cell cycle regulator is inhibited, there will be growth. A regulator is there to stop the cell cycle. The cell cycle needs to stop. Otherwise, we are going to grow bigger, 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 and we are going to have tumors all around our bodies. Right? So there are regulators in a cell cycle. Now, mTOR is a regulator. When the cell cycle regulator is inhibited by these proteins, hamartin and tuberin, we have tuberous sclerosis. We have multiple growths in the body. Now, where are those growths? Let's learn about those. I hope you have taken a screenshot of this also, or you have noted it down. I have already made notes for you. The notes are also uploaded and they are available for you to download and read. If you're not able to make notes right now, please go through my notes. I have a decent handwriting. I think you'll be able to grasp what is written very nicely. Please go through the notes, take the notes. Right. So now coming on to the features of TSC1. Sorry. So tuberous sclerosis. Now the features of tuberous sclerosis are more or less similar. So tuberous sclerosis, we will read about the features in together, right? हम एक साथ ही उसके बारे में पढ़ेंगे कि कौन कौन से features रहते हैं. So tuberous sclerosis, we have some major features and we have certain minor features. Now there are mnemonics for both. The mnemonic for major features is FAST, FA2, S3 and T, and the mnemonic for minor features is C3G. The mnemonic for major features in tuberous sclerosis is this fast, and this is CG, C3G. Let's learn about what are these mnemonics stand for. F stands for facial angiofibroma. Facial angiofibroma. A2 means there are two features that start with A. One is an ash leaf macule. We all know about it, right? But we need to remember in sequence, we need to remember that ash leaf macule is the most common cutaneous feature, skin feature of tuberous sclerosis. So one is ash leaf macule, and second is renal angiomyolipoma. Renal angiomyolipoma, right? So this is one. Now there are three S. One S is for sebaceous adenoma. We know sebaceous adenoma. आपने देखा भी होगा. On the nose, there are certain raised nodules in some people. Very few people you must have seen. I have seen in my OPDs, so I think I have seen more. But then there are patients who have these typical sebaceous adenomas. Don't worry, we are going to look at the pictures also. Then there are subependymal tumors. Subependymal tumors. Subependymal tubers. Now, subependymal tubers are a feature of the MRI brain, and if we do an MRI of a tuberous sclerosis patient, you'll find these. And the third is very important to remember, SIGAs, because this is the most common brain manifestation of tuberous sclerosis. SIGAs are subependymal giant cell astrocytomas. Subependymal giant cell astrocytomas. And then T stands for, what does T stand for? T stands for the cortical tubers. One S is also for Sjogren's patch. So both of these we can put in one because these are both subependymal tumors as well as SIGAs are features in the MRI brain, and they are both tubers in the brain. So we can put those together, subependymal tubers and subependymal giant cell astrocytoma. The third S can be Sjogren patch. Sjogren patch is a raised nodular rough structure usually present on the back behind the lumbosacral region. We will look at the pictures. Be patient with me. Right now, remember this cortical tubers. So, what we have is facial angiofibroma, we have ash leaf macule, we have renal angiomyolipoma, we have sebaceous adenomas, we have two S here for subependymal tubers and subependymal giant cell astrocytoma, Sjogren patch, and cortical tubers. I hope you remember that, right? Now, minor features. What are the minor features? The minor features are not very commonly seen in patients, but can be asked in exams. They have been asked in last 2 years. So let's go through the questions, right? Confetti skin lesions. Now, as we have seen confetti, you must have seen confettis put in birthday balloons, and they are little pieces of paper, bits and pieces of paper. Like that, only bits and pieces of hyperpigmented spots on the body, especially on the trunk, are known as confetti skin lesions, also present on the limbs, but mainly on the trunk. So these are confetti skin lesions. The third C stands for multiple renal cysts. Multiple renal cysts. Multiple renal cysts. And the third C, the second C was for the renal cysts. The third one is for cerebral white matter radial migration lines. Cerebral white matter radiation migration lines. Radiation migration lines. This is one of the questions that was asked in recent exams, so please remember this. And then we come to G. Now, G is very important. G stands for gingival fibromas. Gingival. Gingiva is your gums. Your gums are known as gingiva. So, gingival fibromas, right? So, let's look at these again. One is confetti skin lesion. Second C is for the cyst. Third C is for cerebral white matter radiation migration lines. And G is for gingival fibromas. Not very tough to remember. But if you remember with the mnemonic, you will. right? You will be able to remember. So let's remember it with the mnemonics. So we'll remember the mnemonics: fast and C3G. Now, what are the questions that are usually asked in this, in tuberous sclerosis? The questions from this slide, let's remember the questions from this slide. The questions from this slide are going to be, one is, what is the most common cutaneous manifestation? Let's take another color for this. Let's see green for the questions, right? What is the most common cutaneous manifestation of tuberous sclerosis? That will be ash leaf macule. Most important, most common brain MRI feature of this is a SIGA. This is very specific. If you find subependymal tubers, not very specific for TSC, but if you find a SIGA in the MRI, it is definitely tuberous sclerosis until proven otherwise. You can't prove it otherwise. If there is a SIGA, it is TSC. So SIGAs are important. Then renal angiomyolipoma. We usually ask about histology of renal angiomyolipoma. Please remember these two things about this. One is the Hounsfield unit on CT is minus 20. This has been given in one of the questions, one of the MCQs earlier. That's why I'm telling you this, minus 20 Hounsfield units on CT. It doesn't have a true capsule. No true capsule is there, and it easily bleeds. It easily bleeds. And as you can see in this lump or in this benign tumor, there are blood vessels, angio, blood vessels. Myo is for muscle fibers, and lipoma is for fat cells. So there are fat cells, there are muscle fibers, and there are blood vessels. So that is one thing. That is one thing. Now, we know what is the common manifestation in MRI brain, but what is the most common uh, clinical feature, neurological clinical feature? See, this is a neurocutaneous syndrome. So, neurological clinical feature most common will be seizures. You must have seen infantile spasm patients, or if this word comes in your exam, infantile spasm, again the answer will probably be tuberous sclerosis. Remember that. So, infantile spasm. Moving on, this is one question that has been asked earlier: cerebral white matter radiation migration lines about cyst. So, question can go like, a 28-year-old patient has been found to have multiple renal cysts on CT scan, on his CT abdomen plus KUB, and you can they can show you a picture of sebaceous adenomas or ash leaf macules. Now, please remember that caffeolar macules were hyperpigmented, but ash leaf macules are hypopigmented. Ash leaf macules are hypopigmented macules, right? Macules, what is a macule? I hope you all know that. Macule is an unraised patch on the skin. It's like a patch, and it's not raised. If it is raised, it's either a nodule or a papule. But if it is not raised, it's a macule. So if it is hyperpigmented and it is some genetic disorder that has been asked, usually caffeoly spot and F1. If it is a hypopigmented macule, there are multiple renal cysts in the patient, or the patient is having seizures, frequent seizures, or the patient is having low IQ, then please go ahead with writing your answer as tuberous sclerosis, right? That will be your answer. So let's remember that. Another question that is usually asked is, what is the most common site of SIGAs? So that is foramen of Monro. What is the most common site of SIGAs? Foramen of Monro. Again, students, I have put all of these along with the previous year's questions in my notes. So you can buy the notes and you can listen to the chapter right now. Okay, focus on this. So the most common site of SIGA will be foramen of Monro. Moving on. Okay, I hope you're ready again. So, okay, right. Let's look at the pictures now. One and two. First, let's look at this picture. So if you can see, this is all tuberous sclerosis patients' features. Number one, these are hypopigmented macules. These are known as ash leaf macules because they are shaped like a leaf. They are known as ash leaf macules, but please remember they are hypopigmented patches as compared to cafe au lait spots. Right now, this is a shagreen patch. This is a shagreen patch. A shagreen patch is usually present on the middle back and it looks like this. It's a raised structure on the back. And these are the subungual fibromas. I'm so sorry. Excuse me. Subungual fibromas are the lump-like benign tumors that are present on the nail bed. They can be present on fingernail beds also or toenails, but mostly on the toenails. That's a practical point for you when you start seeing your patients. So subungual fibromas is one. And moving on to this one, this is sebaceous adenoma. This is the lesion that I was talking to you about. These are sebaceous adenomas. Now, while going through our MBBS, we have all learnt about this mnemonic. Epiluia, right? Adenoma sebaceum, low IQ, and epilepsy. This is the triad of tuberous sclerosis: epilepsy, low IQ, and adenoma sebaceum. You must have gone through this. You must remember that. Right. Now, please also do remember in the treatment of tuberous sclerosis, usually it is asked what is the medicine that can be given. So one is sirolimus, the second is everolimus. Everolimus is the one, practically speaking, we have given to our patients, and I still prescribe that. Now, sirolimus, everolimus are actually acting on the mTOR pathway. Okay, so they are acting on the mTOR pathway. They ask you the mechanism of action. This will be the mechanism of action. Another thing, for patients of infantile spasms also having tuberous sclerosis, vigabatrin is a medicine, is an anti-epileptic that is used for infantile spasms. So please remember these three names. These are important for infantile spasms. So these three names are important: sirolimus, everolimus, and vigabatrin. Now let's move on to the other neurocutaneous syndrome. Keep looking at the pictures, put those in your mind. Let's delete these and move on to the next one. Now the rest of these are pretty easy, pretty simple. Let's know a little bit about von Hippel-Lindau. VHL, von Hippel-Lindau. Now there's a tumor suppressor gene on chromosome 3p. Chromosome 3p, there is a tumor suppressor gene. All of the neurocutaneous syndromes that we have learnt about till now are autosomal dominant. There is a tumor suppressor gene on 3p. This gene is inhibited in von Hippel-Lindau syndrome. So what do we find in this? We usually find renal cysts, renal cell carcinoma, liver hemangiomas, pancreatic neuroendocrine tumors, next hemangioblastomas. Two places: CNS, retina. So retinal hemangioblastoma is a feature of von Hippel-Lindau syndrome. And what is the most common site of hemangioblastoma in CNS? That question is also usually asked. So one is cerebellar hemisphere. This is the most common site, followed by conus medullaris. Conus medullaris is the lowermost portion of the spinal cord. And then there is cervicomedullary junction. Now, cervicomedullary junction is the highest, the uppermost portion of the spine. So, cervicomedullary junction. So, you first put in your mind that it is in the cerebellum most commonly, then lower spine, conus medullaris, and then come back to cervicomedullary junction. That's how you're going to remember this. So, cervicomedullary junction. Now, this is pretty easy. Very few questions asked in this. Let's learn about what are the previous year's questions that have been asked. Number one is, which is the chromosome involved? So, chromosome 3p. Is it a tumor suppressor gene? Yes, it is. Is it an autosomal dominant disease? Yes, it is. Now, multiple renal cysts are also found in tuberous sclerosis, but in von Hippel-Lindau, very few cutaneous features are there. Only hyperpigmented macules, but nothing specific, nothing very sensitive or specific that they'll give you. If they are giving you a cutaneous feature like a subungual fibroma or a sebaceous adenoma,